Hi guys, it's me, Professor Dia. Welcome back to my YouTube channel. On this video, we're going to be doing another case study, and it's going to be on bacterial meningitis. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, Nexus Nursing Institute Talk. I can't speak, nexusnursinginstitute.com. There you can sign up for Next Generation NCLEX review session, part 1 and part 2. Matter of fact, I'm doing a review session in about an hour. My part 1 is in about an hour. I do the review sessions once a month. So if you miss it, you have to wait until the next month. In part 1, I teach you how to think critically. I teach you about words and phrases and scenarios that NCLEX will present to you and where your brain is supposed to go with that information. I teach you about prioritization and delegation. In part 2, we actually go over NCLEX type questions, rationales, and how to apply them to the type of questions that you get. Also on my website, if you are a current nursing student and you are struggling, you have to do really well on your next exam. Check out my audio lesson. See if I have an audio lesson that matches your next exam. Also, maybe you want to pick my brain about something. You can sign up for a consultation session, or if you like private tutoring from me, you can sign up for that. I book very quickly. I'm warning you now. However, I do offer that. Again, all those resources are available on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, right here on YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. I want you to take a look at this case study. It says, you're a nurse working in the emergency department when a 20-year-old college student, John, arrives with a complaint of severe headache, fever, neck stiffness, and sensitivity to light. His roommate reports that John's been experiencing flu-like symptoms for the past 2 days, but his condition worsened overnight. Upon assessment, you note the following: vital signs, temp 102.9, heart rate 110, respiratory rate 20 breaths per minute, blood pressure 100/60. Physical exam, Brudinsky signs positive, Koenig sign positive, skin shows no petechial rash. The lumbar puncture has been ordered. Cerebral spinal fluid analysis reveals an elevated WBC, increased protein levels, decreased glucose levels, excuse me, and cloudy appearance of the cerebral spinal fluid. John is diagnosed with bacterial meningitis. Here's the thing, guys. I'm telling you right now, when it comes to NCLEX, usually they're not that nice. They're not going to tell you what the patient's diagnosed with, because that's going to be one of your questions. What diagnosis would you suspect? Okay. You've been given enough information to suspect that. That's number one. Number two, NCLEX is not going to be that nice. Look at the physical examination. You see how the Brudinsky and the Koenig sign is positive, and they even tell you what that Brudinsky and Koenig sign is. No, on NCLEX, they expect for you to recognize which one's a Brudinsky, which one's a Koenig's, and what those signs possibly mean, what diagnosis it's associated with. Okay, I can create so many test questions from this case study by itself. So the first thing I would encourage you to do when you're presented with a case study, the first thing you're going to do, highlight, underline, or kind of mark everything that's abnormal. Why? That's going to make all the abnormalities jump out to you so you can create a clinical picture of what's wrong with your patient. So the first thing I do as a nursing student, I'd go ahead and point out whatever that complaint is. When it say patient presents with or patient complains of, that's important to you, right? That's a problem. So I go ahead and point out the severe headache, that's the fever, the neck stiffness, the sensitivity to light, experiencing flu-like symptoms, worsened overnight. When I get to vitals, the temp, the heart rate. When I get to the physical exam, the Brudinsky, the Koenigs. And when I get to the lumbar puncture, that cerebral spinal fluid analysis, the elevated WBC, the increased protein, decreased glucose, and cloudy appearance, all of those are abnormal. All of that clinical picture, plus the fact that this is a young adult that has a roommate, because this is, when it comes to bacterial meningitis, this is a classic picture. They're going to present either an older teenager or a younger adult that is either in college in the dorms, or that is in like barracks, close quarters with other people, like maybe the army or the navy, maybe even prison, right? And then they're going to present those symptoms such as the nuchal rigidity, that neck stiffness, the fever, the severe headache. Okay. Anyway, moving on. You have this picture. I have a couple questions for you, and then I'm going to make some points because I took some notes, some other things I want to talk to you guys about. So my first question, are you guys ready? Of course you're ready. Let's go. A nurse is caring for a patient with bacterial meningitis. This is your patient, right? Which intervention would the nurse prioritize? Here are your options. 1, administering antibiotics within 60 minutes of arrival. 2, placing the patient in protective isolation. 3, elevating the head of the bed 90 degrees. Or 4, encouraging oral fluids to maintain hydration. Let me repeat that. You are the nurse caring for the patient with bacterial meningitis. Which intervention would you prioritize? A, administering antibiotics within 60 minutes of arrival. B, placing the patient in protective isolation. C, elevating the head of the bed 90 degrees. Or D, encouraging oral fluids to maintain hydration. The first thing you're going to do is put that patient in isolation. I'm not going to say which one yet because that's going to be another question, but this is a famous test question. You need to know that. And I know many of you guys would jump to, oh, antibiotics. This patient needs antibiotics right away. They do. But imagine you treating that patient while they're still exposing everybody else. Your job is to protect the public. So the first thing you're going to do is get that patient in isolation. And here's the thing, you getting that patient in isolation, nothing has to be confirmed because remember, it's going to take days before it's actually confirmed, yeah, this patient has bacterial meningitis, not anything else, because guess what? Cultures take a while, right? So you're not going to wait for that result to come back for it to be confirmed before that patient's in isolation. All you need to do is suspect, and that patient goes in isolation, and you have more than enough information here. Even if they didn't tell you what that patient's diagnosis was, just with this first part of the case study, them telling you that this is a young adult, severe headache, fever, neck stiffness, my goodness, the minute you saw that nuchal rigidity, you saw that neck stiffness with the fever, headache, boom, you should have already said meningitis. All right. Photosensitivity, sensitivity light. That's photosensitivity. You should have already said to your mind, meningitis, boom, that patient's going to isolation. We don't play those type of games over here, right? That is the first thing you're going to do. You are going to protect the public immediately after that patient goes into isolation. Well, I'm not going to tell what you're going to do next because that's another question within itself. But that's the first thing you're going to do. That is going to be your priority. Okay. All right. Let's move on. Next question. Which finding in a patient with bacterial meningitis requires immediate intervention? Is it the positive Rudinsky sign? Is it the complaint of photophobia? Is it the sudden onset of confusion and disorientation? Or is it the complaint of severe headache? Let me repeat that. Which finding in the patient with bacterial meningitis requires immediate attention? Would it be the positive Rudinsky sign? Would it be the complaints of photophobia? Would it be the sudden onset of confusion and disorientation? Or would it be complaints of severe headache? And the correct answer, guys, is that sudden onset of confusion and disorientation. And I know what some of you guys are thinking, well, Professor D, you taught us about red flags, and the word severe is a red flag. So how come we didn't go with severe headache? Yes, that severe headache is a problem, but guess what else is a red flag that I taught you about? Change in level of consciousness, change in cognition, right? Confusion, lethargy, disorientation, that's also a red flag. So look at the answer. You have confusion, disorientation, and what was it? Sudden onset. Wasn't that word sudden also a red flag? Yes, it was. I taught you that. Anything that is acute and not for the good is bad. When there's a sudden change in the patient's status, we're going to be concerned. So sudden, number one, confusion and disorientation, that's a change in condition too. Those are 2 red flags versus number 4, complaints of severe headache. The severe, that's 1 red flag. And this is across the board, guys, when a patient has a sudden change in cognition, we don't know what's wrong. We have no idea. Patient could be having stroke. It could be sepsis. We have no idea what's going on with the patient, but guess what? We know it's something severe and it needs to be assessed right away. Okay. All right. Next question. What infection control measures are appropriate for the patient diagnosed with bacterial meningitis? 1, airborne precautions until the symptoms resolve. 2, standard precautions only. 3, droplet precautions for at least 24 hours after antibiotic initiation. Or 4, contact precautions for the duration of the hospitalization. I'm going to repeat that. What infection control measures are appropriate for a patient diagnosed with bacterial meningitis? 1, airborne precautions until symptoms resolve. 2, standard precautions only. 3, droplet precautions for at least 24 hours after antibiotic initiation. 4, contact precautions for the duration of hospitalization. And the only correct answer here, guys, is droplet precautions. That patient's going to be on droplet precautions for at least 24 hours of antibiotics. Why? We need to decrease the infectiousness. I don't think that's a word. Infectiousness. Is that a word? Infectiousness? I hope it is. We we need to decrease infectiousness as much as possible. So that patient needs to be on antibiotics for a full 24 hours before they can come out of this isolation. They're going to be on droplet precaution. Okay. Now, remember the antibiotics that the patient is going to get, it's going to be broad spectrum because we are not sure 100% what type of bacteria it is, what it's going to be sensitive to, what it's going to be resistant to. This patient's going to be on broad spectrum. And then when the culture comes back and it's specific, then that antibiotic is going to change. But we're not going to wait for that culture to come back. Why? Because time is of the essence. This is something that is very lethal. So we're going to get antibiotics to the patient as soon as possible. When I say as soon as possible, number one, that patient's going into isolation. Patient's going to be on droplet precautions. Immediately after that, you're gonna get your cultures, and right after that, patient's gonna go on broad spectrum antibiotics in that order, very rapidly, one after the other. Okay. The wrong answer is airborne precautions. No, again, the patient's on droplets. Standard precautions only. Only. The minute you saw that word only, you should have known that wasn't the answer. I tell you guys a million times, stay away from these all-inclusive such as only, never, always. And then last, contact precautions for the duration of hospitalization. Again, that patient's going to be on droplet precautions and they're going to be on isolation for at least a full 24 hours of antibiotic therapy, at least, minimum, okay? I'm paying attention to the time because, again, I have a review coming up. Okay, next question. Which laboratory finding is most concerning in a patient with bacterial meningitis? 1, a WBC of 15,000, 2, serum glucose of 70, 3, a cerebrospinal fluid of 20, or 4, serum sodium of 140. I'm going to repeat that. Which laboratory finding would be most concerning in the patient with bacterial meningitis? 1, WBC of 15,000, 2, serum glucose of 70, 3, cerebrospinal fluid glucose of 20, or 4, serum sodium of 140. And guys, the correct answer is the cerebrospinal fluid glucose of 20. Why? Why do you think that CSF fluid is so low? The bacteria is consuming it. That's why it's so low. That is the biggest complication that we're looking at here that we're going to be concerned about. Okay, WBC 15,000. Yeah, WBC is supposed to be 5 to 10,000, but the patient has an infection. The WBC is going to be elevated. It's not elevated to the point that, it's the biggest concern here, right? It's elevated slightly, and we expect that because it's an infection the patient has. The serum glucose of 70, normal glucose is 70 to 110. It's on the low end of normal, but still normal. And then serum sodium of 140, your normal sodium is 135 to 145. It's smack dab in the middle. We're going to be concerned about that low CSF glucose. And I'm telling you right now, the reason it's so low is because of the bacteria consuming it. That's what's happening. Okay, last question. The nurse is monitoring a patient with bacterial meningitis for complications. Which findings should be addressed first? One, a temperature of 101.4. Two, a blood pressure of 88 over 56. Three, a heart rate of 100. Or four, a complaint of a mild headache. I'm going to repeat the question. The nurse is monitoring a patient with bacterial meningitis for complications, this patient. Which finding should be addressed first? Would it be a temperature of 101.4? Would it be a blood pressure of 88 over 56? Would it be a heart rate of 100? Or would it be complaint of a mild headache? And I hope you all chose that blood pressure of 88 over 56, hypotension. We're concerned about those organs shutting down, right? The fact that that blood pressure is so low, this is life-threatening. Maybe there's circulatory compromise. Maybe there's increased sepsis. We don't know, but we know something is severely wrong. Whenever you are being questioned about a priority, you always have to say to yourself, what is going to kill my patient the fastest? That's going to be your priority. That's what you're going to be concerned about. All right. A temperature of 101.4, yeah, that's a fever, but it's not such a high fever that this patient's burning to death from the inside out. A heart rate of 100, well, your normal heart rate 60 to 100. So it's the high end of normal, but still normal. And then a mild headache. Patients with meningitis, they'll usually complain of a severe, ding, 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 red flag, severe headache. Their headache's only mild. Why are we choosing that? We're going to be concerned about those organs starting to shut down because perfusions decrease because that blood pressure is so low. That hypotensive state, the blood pressure of 88 over 56. So guys, those were the questions. These are typical questions that you may get regarding meningitis when it comes to NCLEX. My rationales, that is what those questions are based on. So you need to understand the rationale. Don't try to memorize a question and the answer. You're not going to get the same question and answer, but the rationale that they're based on, you're going to get. So that's what you need to understand. I wrote some notes because a couple more points I wanted to bring to your attention. The first thing, initial nursing action. I talked to you about this already, but I really want to drill it into your head because usually this question is presented as a drag and drop where they give you the priority actions and you have to figure out the steps. Again, I cannot stress this enough. The minute you have those signs and symptoms, you suspect this patient's got meningitis, you're immediately going to put that patient in isolation first. Then you're going to draw for culture, and last immediately after the patient's going to get antibiotics. So, with that being said, other important things you got to keep in mind, you want to get a baseline on your patient. You want to get vital signs. You're going to do a full neurological exam. Patient's going to be on droplet precautions. You're going to notify the healthcare provider. But remember, you have to assess your patient to get information, to have information to give to the healthcare provider. So you go notify healthcare provider. Patient's going to get antibiotics. They're going to get antipyretics because guess what? They're going to have a fever, right? You're going to monitor for signs of increased intracranial pressure. Please make sure you review that. Make sure you know the signs of increased intracranial pressure. You're going to make sure that you provide access for IV because this patient's going to be at risk for hypovolemia, so they are going to get IV fluids. All right, let's talk about pharmacology, some drugs, antibiotics. Again, you'd expect broad spectrum antibiotics such as ceftriaxone or Venco. Remember, we're pulling out the big guns because this is a very severe and lethal infection, right? We don't give Venco just for any old body. These are the big guns. So when it comes to that, you're going to be looking at the urine output, the GFR, the BUN, the creatinine. You're going to be checking that kidney function. You're going to be assessing the patient for ototoxicity, ringing of the ears, because you know how harsh it is going to be on the kidneys, also on hearing. You're going to do those assessments on the patient. Also, guys, you expect the patient to be on something like dexamethasone. Why? Decrease inflammation of those meninges. We're going to be concerned about that. Remember, complication of this medication is also hearing loss. We're going to be concerned about that. And whenever it comes to Steroids, we're going to be checking that patient's glucose levels. We're going to be checking them closer for signs and symptoms of infection. Remember, steroids can cause the bones to be porous, so their bones can fracture more easily. We're going to be concerned about that. Ulcers, they're very hard on stomach. They can cause ulcers, so we're going to be assessing the patient for that. Antipyretics, like I said, because the patient's going to have a high fever, we need to bring that temperature down. And of course, IV fluids. We want to avoid hypovolemia in the patient. So those are going to be the top drugs you expect to be administered to this type of patient. And the last thing I wanted to bring to your attention was ICP. I mentioned it briefly, but you are going to be watching out for those signs and symptoms of ICP: confusion, lethargy, disorientation. You're going to be watching out for Cushing's triad. You need to recognize that, guys. That's going to be the widening pulse pressure. That's going to be the bradycardia. That's going to be the irregular respiratory patterns, such as chain strokes. You see those you see those three together. That is Cushing's triad. That is a medical emergency. You are going to notify the healthcare provider immediately, okay? You're going to be watching out for papilledema. Of course, this patient's going to be on seizure precautions. You're going to have that bed in the lowest position. You're going to have the what's that thing called? Side rails. You're going to have the side rails padded. You're going to decrease stimulation. You're not going to have bright lights. You're not going to have the TV or radio on. We're trying to decrease stimulation. You're going to have the blinds closed. You're going to have the patient at the end of the hall, not next to the nurse's station where it's loud and the phones are ringing and people are talking, right? This patient's definitely going to be on seizure precautions. This is a very serious condition. Please, everything that I mentioned, guys, go back into your textbook. Your textbook is your best resource. I know you hate reading your textbook. You'd rather watch me on YouTube or watch another of your favorite creator or listen to a lecture, anything but reading the textbook. But guys, I'm telling you, the textbook is where your answers for your test are coming from. Those tables, those diagrams, those charts, those boxes that you never want to pay attention to, those nursing alerts. I bet you go in your textbook right now and everything that I pointed out to, surprise, surprise. It's in the nursing alert. It's in the box. It's in the table. It's in the diagram. It's in the illustration. Don't say I didn't warn you. Okay? I'm on your team, guys. I'm trying to help you. Listen to me. I will not steer you wrong. So anyway, that is meningitis in a nutshell. I have about half an hour to prepare for my review that's coming up. So I hope that this was helpful for you. If you are studying for NCLEX, go to my website now. It's too late to take the review that I'm about to give in half an hour, but you can sign up for my review next month. My website is nexusnursinginstitute.com. There are so many resources there available for you. Check it out. Thank you for watching this video, and you guys will catch me on the next video.